Chief Administrative Secretary, Ministry of Health, Dr. Mercy Mwangangi, President of the Pharmaceutical Society of Kenya, Dr. Louis Mashogu, Captains of Industry, KQ Cargo Director, Mr. Dick Murianki, KQ colleagues, all protocols observed. Good morning, and thank you very much for hosting KQ Cargo in this event. We are extremely excited to be part of this event. And I'd like first to begin by really recognizing the enormous contribution from all the healthcare workers who are part of the audience today. We know there has been enormous sacrifice that has gone into dealing with the pandemic in our country. And so we'd like to begin, first of all, by saluting you for the excellent work that all of you are doing. Allow me to begin, first of all, by articulating KQ's purpose. And really, our purpose is contributing to the sustainable development of Africa. I'd like, first of all, to just pick a couple of pointers from Dr. Mwangangi, and she did raise a big concern that we've seen cost escalations of pharmaceutical products over the last year or so. And I'd like to begin there by saying that from a KQ Cargo point of view, we have been very instrumental in working towards mitigating the logistical impacts that came with COVID-19. One of the major challenges experienced by the industry was really the cutback in capacity of all the passenger aircrafts globally. IATA estimates a reduction of about 50% of global capacity was withdrawn from the market. And given the demand-supply dynamics, this had really a cost escalation impact in terms of access to flights for all the medical supplies from the various global origins. And I'd like to just highlight a few areas KQ has been involved in. With this impact in 2020, we also did support the industry here, the horticultural industry, in moving a lot of horti products into Europe, which is really the mainframe product out of Kenya. But over and beyond that, there were a lot of PPE movements out of China and many other parts of the globe. And from a KQ Cargo point of view, we moved over 8,000 tons of pharma and PPEs in 2020 to support the healthcare needs in our country. Allow me to also mention that we just finalized the installation of a world-class pharma facility within a Jomo Kenyatta Airport hub. It's 600 square meters of pharma infrastructure that has three buckets of compartments, and we'll come into that during the presentation. Now, I'd like to just mention also part of the reasons why KQ Cargo invested in world-class pharma infrastructure is we've seen across the years the disease burden across Africa, and ever so often we have disasters happening across the continent. And ever so often our customers are asking us to provide cool chain infrastructure. So in 2018, we took this as a strategic objective, and the KQ board approved the investment, which was completed just September last year. And this facility is really state of the art. We had Dr. Rashid from the Ministry of Health and his team visiting our facility last week. And really the sentiments and the improvement directions that they've given us were really welcome. The need for the farmer infrastructure was informed by the need to maintain temperature integrity of the pharmaceutical products. One of the things our customers said to us was that the largest challenge in terms of transportation of pharma products is really on the ground, because on the air, normally we can control the temperature levels quite well, but normally when these products touch the ground, all hell breaks loose. And the objectives of really implementing this infrastructure was to ensure that the excursions on the ground are really mitigated. Now, I'd like to also mention to the audience that Kenya has a very unique positioning in terms of cool chain management. In the back of our expertise in moving horticultural products, the industry in Kenya, unlike many other parts of the continent, has really acclimatized to cool chain processes. And whereas we do understand that for horticulture is strictly 2 to 8 degrees, for the pharma products, the temperature ranges would vary. We have the ambient, we have the frozen temperatures, and this really was a plus for Kenya, and is a big plus for Nairobi as a distribution hub, because we have really one of the best set infrastructure facilities within the continent. Now, I'd like to, over our presentation, just touch on a couple of things, and the objectives being to just inform you what KQ Cargo is in the process of implementing to support the industry requirements, as well as we would like to take out feedback from the audience in terms of areas of collaboration and areas of opportunity that you see yourselves partnering with KQ. So we'll go through a couple of elements here, and of course that is, let me just go quickly, access to countries, securing of the COVID-19 vaccine capacity. We'll talk about one of the questions also asked about flown as booked, the need for the shipments to really come on time. I think that was really insisted in Dr. Mungangi's presentation. We'd also like to talk about the priority as an airline we're giving to the COVID-19 vaccines and humanitarian supplies, and of course, temperature control on arrival. I'll begin by saying that KQ has the privilege to have been nominated within the Humanitarian Air Freight Initiative, which was launched by UNICEF. UNICEF is the appointed distributor of the COVAX facility, which which is in essence moving about 20% of the global pharmaceutical or rather COVID-19 vaccine requirements. Now, this is really a gigantic task for the logistics sector. IATA did estimate that for us to fully vaccinate the globe, we would need about 7 to 9,000 747 freighters. Each freighter has a capacity of about 100 tons. So it's really a gigantic um, uh, responsibility for the logistics industry. I'll talk a bit about our network footprint and how KQ Cargo has positioned itself. At the moment, we are touching over 31 countries in Africa. We strategically are providing capacity to key points in India, actually Mumbai and Delhi, which are critical origins of the COVID-19 AstraZeneca vaccine. We actually opened up Delhi in the month of February 2021 to position our network to be able to touch all the source markets of the COVID-19 production areas. Out of Europe, we are also providing an ad hoc schedule into Frankfurt, which we also began in the month of February. And the reason our network has been extended to these points is in the COVAX demographic supply chain footprint. You will see that they've actually defined 4 source origins of the COVID-19 vaccines. So this is really Europe, North America, which is ideally the US and Mexico. And then we have the Middle East, India, and of course, China. So I'd like to assure the audience today that the KQ Cargo network does indeed touch all these key source origins, production origins globally. And we'll be very happy if you would put us in touch with a lot of your partners in those markets. We are very clear that the commercial movements will take some time to come through. Now, in terms of COVAX, I did mention that the supply chain requirements will really be around 2 billion vaccines in 2021. And the distribution requirements for this were 950 million doses for the 92 AMC countries. Kenya falls within this bucket, and 90 self-financing economies, which will also get another 550 to 950 million doses. And UNICEF, through the COVAX facility, have actually buffered about 100 million doses. What we see from the logistics direction is that there has been a delay in terms of the distribution logistics. Initially, the approach from the distribution bracket was that they were talking about equitable distribution of the vaccines to the most needed populations first. But we see this is really being restructured. So in terms of the mass movements into Africa, I can confidently tell the audience that this is really not going according to plan. There is a lag in this process. And we know that a lot of the, some of the self-financing economies have actually been even more harder hit. by the COVID-19 pandemic. And I think that's where we see the restructuring in terms of the prioritization. Now, so really what is at task is about distribution of 2 billion doses over the year. One of the logistical advantages that KQ has also obtained from the mapping around the COVAX logistics footprint is that we've been able to scope areas that can and cannot be covered within the logistical framework. And the risks are really minimum, looking at those 4 critical origins, UNICEF nominated 4 freight forwarders, global freight forwarders. I think this is DGF, DHL Global Forwarding, Kuhn and Nagel, Schenker, and DSV. And they did map a global logistical footprint in terms of which countries cannot or have difficulties being touched with the current shape of the commercial flights. And the reason behind this is, as we all know, passenger traffic globally has severely been impacted. So many schedules are not operating globally because of all these COVID protocols that have been very complex for the aviation industry. But the risk, as assessed by the nominated forwarders, was that really only 2% of the AMC 92 population may not essentially be touched by the logistical flow. So for these, there are options to do charters, dedicated charters into these specific countries. And I'd also like to comment here that KQ Cargo is capable of providing charter solutions across the continent. We are running multiple charter missions since the onset of COVID-19, touching really every point in Africa. So one of the really value-add elements we'd like to communicate to the audience is that we are ready to work with you and your partners, not only on the known logistic lanes, but where necessary, we can deploy charter missions for your requirements. Now, let me come back home and just talk a bit about our warehouse infrastructure and the value-add services that we are providing at Jomo Kenyatta. As I mentioned, we launched the state-of-the-art facility in September 2020. The facility has a capacity to store about 300 tons of pharma. It's split into three chambers. The first one is the ambient, which is a 15 to 25. It's about 340 square meters. Then we have the cool room, which is 200 square meters. And lastly, we have the freezer. Our freezer can actually go up to -20. And in the visit we had from Dr. Rashid last week, one of the ideas that they've shared with us is that KQ Cargo should look at expanding our freezer compartment, specifically linking to the opportunities that the industry sees coming out of the Pfizer vaccine. So through the support of Mr. Murianki and the KQ senior leadership, we will be pursuing that to really expand the freezer infrastructure that we have at Jomo Kenyatta. But I'd like to also comment that this is not a unique challenge. only for Africa. Uh, uh, Historically, very few facilities globally had really positioned themselves to the -70s that we've seen coming off the Pfizer vaccine temperature control requirements. And this is a classical learning point for us in terms of the improvements we can give to the industry. Now, just to clarify, the 300 tons is equivalent to 3 Boeing 777 freighters, each carrying roughly about 100 tons. So that tells you that the capacity is quite robust. And one of the things we've picked out from the farmer movements is that they really don't spend much time within our facility. They are cleared quickly. And this is just to assure the industry that we can really support your requirements in terms of the temperature control. And one of the unique element around our farmer infrastructure is when we were going through the GDP process. That's a good distribution practices process. Our consultant advises that segregation is a must. So we have segregated the perishable infrastructure with the farmer infrastructure, so there is no contamination of the product. In terms of the export flow, we do the acceptance under the temperature controlled environment. And of course, we've talked about the storage. Then one advantage which KQ also has is that where the aircrafts park on arrival or on departure is really about 200 meters from the warehouse. So this really negates the risk of temperature excursions by long transportation transfer points. And we really see that as a very good value add for you. I'd like to also just highlight something around security. The facility is fully equipped with CCTV coverage. And of course, we do have excursion notifications that come off the facility to our supervisory teams whenever any temperatures within the 3 chambers will go off. So our ambition really is to create a secure hub, fastest secure transit pharmaceutical hub in Africa. And we have, apart from what we mentioned, I'd like to just touch on the priority schemes that we are using. We ensure that pharma is last loaded on the aircrafts. This minimizes or rather helps to maintain the temperature control. So when loading our aircrafts, really pharma goes in last, it's transferred last from the warehouse, and on arrival, it's actually offloaded first. So we have like a first in, first out, last in. Kind of a process in terms of how we manage the loading priority on the flights. We also giving dedicated vans in transferring the pharmaceuticals from the aircrafts to the warehouse. And I just wanted to touch also on active containers. At the moment, we have contracted four companies that are providing us with active container solutions. And the reason we took 4 was we wanted to give a wide opportunity because at the moment, the active containers are on extremely high demand globally. At some point, we did contact one of the providers, and they were really maxed out. But we know that there are heavy investments that are going into the active container pool as well. For the active containers, we did mention, of course, the trigger alarms on temperature excursions, re-icing. On the same front, we have back-end contracts and agreements with providers giving us re-icing support. So for pharmaceuticals that are transported beyond the limits of the dry ice management principles, and they require transit support, this is a service that KQ Cargo is providing. Furthermore, we are also providing battery change for the active containers. We are also recharging the active containers. This infrastructure is available within our facility. And we, of course, have done our very best in order to keep the costs within reasonable perimeters, try to negotiate really reasonable limits for demurrage, because in many cases where the active containers are ordered, we have a grace window within which we require to return the empty containers. I think I'd like to stop there, and let me just touch on the last item here around certifications and licensing. We have 90% completion level for the industry certification for IATA, which is CIV, Certificate of Excellence for Independent Validators for Pharma. There is a small bit pending in terms of the data loggers, or rather the temperature monitoring loggers within the facility. We are completing that with IATA, and as well as the GDP process, which has been quite elaborate. It includes having industry standard manuals, which our staff have to comply with. And of course, one of the local elements we are pursuing now is the licensing with the Pharmacy and Poisons Board. We expect to complete this in April 21. And we would like to just say that KQ Cargo is ready to serve you and to offer you unique solutions on your pharmaceutical requirements. I'd like to say a big thank you and asanteni. Thank you.